with a caffeinated response. Thanks a latte.
If you make yourself more than just a barista, if you devote yourself to the beans, then you become something else entirely. A legend, Mr. William, a legend. We witnessed heaven. Then you were gone. Now there's evil. Rise. The coffee man has to come back. But if he doesn't exist anymore, he must. He must.
The coffee cream rises.
Have a nice day.
5, 4, 3, 2, 1, 0. All engine running.
Ladies and gentlemen, boys and girls, children of all ages, welcome to the Ralph William Podcast. And if you're not down with that, we got 2 words for you. Cafecito!
Tranquility Base here. The Eagle has landed.
Un cafecito.
Excuse me, I'm choking on the coffee.
Hey, does anybody want coffee? Who wants coffee? I just made a fresh pot of coffee. Anybody want coffee? Who wants coffee? Anybody want coffee? Who wants coffee?
Having conversations about society, one cup at a time. Coffee with RW.
Un cafecito.
Pour yourself a cup and join us.
Es un cafecito.
Oh, man. Man, it's good to be back. Thank you, everybody, for tuning in. I'm your boy, Ralph William, Coffee with RW, the original Coffee with RW. So many coffee shows out there. But I've been here since 2019 doing the coffee thing. Just wanted to put that out there. If you have your coffee mugs, your travel mugs, your sippy cups, your doggy bowls, if you got a beer hat, you want to drink it like that, then go ahead and do so. And join me in this sip of cafecito. All right. Remember, follow us on X at Ralph William and follow my internet station on X at WESN Radio. Download our mobile app on your app store, Epic Strategies Network, and come help support us by joining our Patreon by going to patreon.com/WESN Radio. I'm also joined by Mama Bear Tracy from the Mama Bear Tracy Show. You can find it on Wednesdays at 1 p.m. on WESN. Good morning, Mama Bear.
Good morning, Ralph.
How are you?
Good, how are you?
How's good old Canada weather?
It's raining.
Oh,
Yeah.
that's a beautiful thing. Not really.
Not really.
We're going to be getting into some Canada talk soon, but, you know, just brace yourself.
Okay.
Good morning, Mr. Duke James from Worldshop DJ.square.site. Good morning, Duke.
Good morning, Rumpy. Glad to see you back in the place, man. It's strange with you not here, bro. I
I appreciate that. Yeah, man. Yeah. It's
I know you gotta do.
gotta do things. Gotta do things. Often imitated but never duplicated. Ralph William. All day, every day. Hopefully you're doing well, sir. How is World Shop doing?
World Shop is doing very well. Doing well. We're getting up there, you know.
Last I saw, you were, I don't know what you did. You were post up at an event or at a at a public area. How did that go?
More likely I was posted up at a public area, just just being me. You know how I do, Ralph.
That's good. That's real good. Good stuff, man. Well, it's nice to hear from you. I hope you're doing well.
Oh, as always, man. It's always nice to hear from you, Ralph. But I'm gonna sit back and I'm gonna just listen because I want to know what's going on in Canadian land. Like everybody.
I appreciate it.
Uh-oh.
So, I mean, it's nothing really Canadian focused. It's just, I want to know how the healthcare system works, man. Because in the radio show this morning, I played several clips of Bernie Sanders talking to a podcaster. And he puts up a good point on how the United States deals with medical debt. And I just thought, like, damn, I mean, he puts up a good point. And I don't see anything good from the other side. Like, sure, they want to say individualized healthcare. Yeah, it's good, but you got to pay for it. But what if nobody can pay for it? So, like, what happens? They just get thrown off on the side? Here's a clip from Bernie Sanders.
One of the number one causes of bankruptcy in America is medical debt, right?
Yes.
Unbelievable. Like people can't, they go in, they don't even know the cost. They sign an agreement that they're going to be billed later, right? It's like, and then they get the bill and it's astronomical and they spend the rest of their life literally a slave to the healthcare system or to the medical billing system or the dealing with their insurance. And not to mention they're sick. So the added stress of that, and it's almost like I'm going to go to the grocery store. I'm going to get an apple, right? I'm going to eat it. And then after I eat it, you're going to tell me how much it costs.
You got it. That is,
and they're like, it's $400. You're like, is it from the Garden of Eden? Like,
but
where is
worse.
this?
You're exactly right. But it's even worse because you had to go to the hospital.
Right. Yes. It wasn't a choice that you made.
So imagine that you go into the hospital. Doctor says, "Theo, sorry, you got cancer, terrible. You're worried to death, right? Your friends, your family are worried. And then on top of that, what are you worried about? Oh my God. What, I'm going to have to sell my house? Or I have to go bankrupt in order to pay medical bills. That is insane.
Yeah.
And it adds, if you're trying to deal with cancer, then you got to worry about financial stress. Think it's going to make your condition any better?
No, the worst. You spend half your day, you can't even, in the insurance companies, it's all a rigmarole. It's constant stress.
It's a corrupt system benefiting the people who own it, not the ordinary American.
One of the number one causes of bank.
Not the American people. So I wanted to ask Mama Bear, because she's from Canada, and I understand that you're not going to know everything or how to explain certain things, but like, what does that look like to you when, you have to go to the doctor or hospital or something like that? Like, what does that look like to you over there?
I call up the doctor. I make an appointment. I go in. I talk to him. And then I leave.
Do you get a bill after that?
No.
So you haven't gotten any bill at all from the medical establishment or whatever, however you want to say it?
No.
Damn. So what about the dentist?
If you have insurance, it will cover so much, and then you pay out of pocket.
So, okay. So
But if you
what's,
didn't,
go ahead.
if you don't have insurance, you would pay the whole thing out of pocket.
Okay, so when it comes to, so what kind of insurance do you get that you have to pay for? Like, there's separate there's separate things, whether it's like something happens to you, you go to the hospital, you don't have to pay for that. But if you have to go get glasses or get a root canal, you have to pay for that.
Yeah, unless you have like insurance, say through your work or personal insurance.
So so if, let's say you're not working, do you pay for that insurance? Or is it like government issued insurance? Like, I'm trying to understand the difference, because I mean, if anybody has to go to the hospital or a doctor, if they have no insurance, they get a bill.
Right.
And they apply for something called like charity care. So, which they might, I don't know exactly how that works. They either cover it or they just give you the bill later, and you just got paid over time. So is that the case over there?
Maybe. I cough. I don't know. Maybe. Just
Is it income based? All right, let me see if I can get some answers
let's see.
with AI.
Oh.
Because I think I don't know. I'm trying to get an understanding.
If you're on social assistance, maybe they might pay for some of it, if not all of it. I don't know how that works. Yeah. Go ahead with your
Which
AI.
is similar from here.
Yeah.
So let me see if I can get this in. Canadian healthcare and United States healthcare. Healthcare. Let's see what we get, and let's see how accurate this AI is. Because when you have people like advocating and pushing these kinds of things, like you must know what you're voting for. Like, you have to understand, like, if you have like Bernie Sanders or Kamala Harris or even like Joe Biden, talking about we need to push this healthcare for all thing. Yeah, it sounds good, but how does it look on paper? Let's see. Oh, is it not done yet? Oh, wow. This is a lot of stuff. Okay. Go for it.
The healthcare systems in Canada and the United States differ significantly in their structure, funding, and access. 1. System structure and funding. Canada has a publicly funded healthcare system known as Medicare, which provides universal coverage to all Canadian citizens and permanent residents. The system is funded primarily through taxes collected at the federal and provincial levels.
Okay, so I paused it there. So it's funded by taxes on the federal and provincial. What's provincial? Is that like your local areas?
Yes.
Okay.
Believe.
So where do you guys collect? Do you know where you guys collect your taxes from?
No.
No? Okay. Let's keep going.
Care is delivered through a mix of public and private providers, but the government reimburses the costs. Patients do not typically pay for services at the point of care. United States. The U.S. has a mixed healthcare system with both public and private insurance options. Major public programs include Medicare for the elderly and some disabled individuals, and Medicaid for low-income individuals. However, a significant portion of the population is covered by private insurance, often provided through employers. The U.S. system is largely market-driven, and individuals often face out-of-pocket costs such as copays, deductibles, and premiums. Number 2, access to healthcare. Canada. In Canada, everyone has access to medically necessary healthcare services without direct charges at the point of use. However, access to certain services, especially specialized care, can be slower due to wait times, which are often cited as a downside of the Canadian system.
So that's one thing that's different.
Yeah, and it sucks.
For certain things, you have to wait to get care for. Whereas, go ahead.
It's like if you need an MRI, you could be on a list for, say, months to almost a year. But if you're willing to travel certain places, you can get in quicker.
So why does the place matter?
Because less people don't want to travel.
Ralph, it's true. One time I was in Canada. And good morning, everybody, by the way.
Good morning. This is Area 81 from the Area 81 podcast. What's up? What's going on, Area? What's up?
Well, one time I was in Canada and I got frostbite on an unsavory place, if you will. And they made me drive all the way to Saskatoon to get it looked at. It was crazy.
Wow. Did they give you is that the reason they gave you because that's where the least people are?
Yeah, I guess frostbite is a very common injury in Canada. Of course, I'm making all this up, but it makes.
Oh my God, Jesus! All right. So, yeah. So that's probably the difference between the United States and Canada when it comes to that. Because in the United States, if you need it, they'll give it to you, but you're gonna pay for it, probably later. Let's move on.
United States. Access to healthcare in the U.S. is more dependent on insurance coverage. Those without insurance or with insufficient insurance may face significant barriers to accessing care. Although the U.S. has some of the most advanced medical facilities and technology, access to these services can be limited by cost, leading to disparities in care. Number 3, costs. Canada. The Canadian system controls costs through government regulation, with the government negotiating prices for services and medications. Overall, healthcare spending per capita in Canada is lower than in the U.S. United States. The U.S. healthcare system is the most expensive in the world on a per capita basis. High administrative costs, the cost of medical procedures, and the price of pharmaceuticals contribute to the higher overall costs. Individuals in the U.S. often pay more out-of-pocket expenses compared to those in Canada. 4. Outcomes. Canada. Canadians generally have a higher life expectancy and lower infant mortality rates compared to the U.S. These outcomes are often attributed to universal access to healthcare and a focus on preventative care. United States. While the U.S. has cutting-edge medical technology and some of the best hospitals globally, it also faces issues like lower life expectancy and higher rates of chronic conditions. These are partly due to disparities in access to care and lifestyle factors. Number 5, patient choice and satisfaction. Canada. Canadians generally have fewer choices when it comes to elective procedures or accessing services outside of the public system, unless they travel abroad or pay out of pocket for private services. However, surveys often show high levels of satisfaction with the overall system. United States. U.S. patients often have more choices in terms of providers and treatment options, particularly if they can afford or have good insurance. However, satisfaction can vary widely depending on insurance coverage, access, and out-of-pocket costs. In summary, the Canadian healthcare system is characterized by universal coverage and public funding, leading to more equitable access, but with some limitations in choice and wait times. The U.S. system offers more choice and faster access for those who can afford it, but at a higher cost and with significant disparities in access and outcomes.
So, the real question, or the one question is, what would you rather have? Like, because if it's like you get healthcare no matter what, you're gonna pay on other things. What were you saying, Albert?
Okay, so every person that works pays federal taxes, and we also pay provincial taxes, and that goes to the healthcare.
Yeah, that's what I said earlier. Yeah. Oh, that's what the AI said earlier.
Oh.
But I was just wondering how are they collecting it? Like, where do you pay it? Is it in what you buy? Like groceries? They take it out of your income? Like, is it a sales tax?
Mostly people's paychecks.
So those who are working are the ones that are paying into the healthcare system.
Yes.
So by that being said, that is more of a burden. You know, for lack of a better word, this is a burden on middle class people that work. And not like your higher ups, right? Like, are the people that make a certain amount of money in Canada, are they still taxed the same?
Is middle class people's tax the same? Is that what you're asking?
Well, maybe here in the United States, I think there's different brackets, like different stages. Like if you make a certain amount, the more you make, I think is going to be the more taxes they take out.
But it doesn't matter. You still have to pay taxes.
In Canada, when they take away taxes federally and provincially for their universal health care, where does that come from?
In Canada, the funding for the universal healthcare system primarily comes from taxes collected by both the federal and provincial territorial governments.
I just said that.
Here's how it works. Federal taxes. The federal government collects taxes from individuals and businesses through income taxes, corporate taxes, and other federal taxes like the Goods and Services Tax, GST. A portion of these taxes is allocated to healthcare funding, which the federal government transfers to the provinces and territories through a program called the Canada Health Transfer, CHT. The CHT is the largest federal transfer to provinces and territories, and it helps fund healthcare services across the country. Provincial territorial taxes. Provinces and territories also collect their own taxes, including income taxes, sales taxes, and sometimes health premiums or payroll taxes, depending on the province. These funds are used to directly finance healthcare services within each province or territory. Because healthcare delivery is primarily a provincial responsibility in Canada, most of the healthcare funding comes from these provincial territorial taxes. Other sources. In addition to taxes, some provinces charge healthcare premiums or fees, though this is less common and varies by province. For example, British Columbia used to have a medical services plan, MSP, premium, but it was eliminated in 2020. Some provinces may also receive additional federal funding through equalization payments or specific grants for health-related initiatives. Distribution of funds. The federal government's role in healthcare funding ensures a baseline level of support across the country, while provinces and territories decide how to allocate their budgets to meet the specific needs of their populations. This system allows for some flexibility and customization at the provincial level, but it also means that healthcare funding and services can vary somewhat between different provinces and territories. In summary, the funding for Canada's universal healthcare comes from both federal and provincial territorial taxes.
Jesus.
These funds are collected through various taxes, primarily income and sales taxes, and are then used to finance the healthcare system, ensuring that all residents have access to necessary medical services.
So is there a different percentage in terms of income that these taxes are being collected? If you're making more money, you pay more taxes?
Yes.
I'm asking the AI.
She's going to say yes.
Well, I like to double check.
In Canada, the income tax system is progressive, meaning that the more money you earn, the higher the percentage of your income you pay in taxes. This progressive tax system is used both at the federal level and in most provinces and territories. 1. The federal government has several tax brackets, with different percentages applied to different portions of your income. As your income increases, you move into higher tax brackets.
Okay, so that's similar to how it is here in the United States. So, what? Go ahead.
You might have to invite Aria back up if you want. So,
let me know. Here's what Bernie has to say about it.
Do you think that Kamala Harris is the best person to run against Donald Trump right now?
Oh my God, no. Wrong clip.
Well, let me give you an example. Can I pick up on your point?
Yeah, for sure.
Okay. I believe we are the only nation on earth, major nation, wealthy nation, that does not guarantee healthcare to all people. Okay? Get in your car, go 50 miles where you are sitting right now in Burlington, Vermont. You have a terrible automobile accident. You're in the hospital for a month in Canada. Do you know what the bill is when you come out? Zero.
Nothing.
Okay. Do you know how much the Canadians spend per person on healthcare compared to us? 1/2 as much. They spend half as much. You don't take out your wallet. If you get sick, you're the doctor that you want. Okay. I believe in that type of system. They guarantee healthcare to all of their people.
Mm-hmm.
It's publicly funded the way we fund police departments, fire departments, and libraries. Okay. You got to pay taxes for it. But at the end of the day, it is less expensive for your healthcare. You follow what I'm saying?
Yeah.
Okay.
Yeah, because you're a proponent for healthcare for all, right?
I absolutely.
And yes, and you always have been. And but how the system seems so rigged because you have like one of the number one causes of bankruptcy in America is medical debt, right?
Yes.
Unbelievable. Like people can't, people, they go in, they don't even know the cost. They sign an agreement that they're going to be billed later, right? It's like, and then they get the bill and it's astronomical and they spend the rest of their life literally a slave to the healthcare system or to the medical billing system or the dealing with their insurance. And not to mention they're sick. So the added stress of that, it just feels like, like something so much better could be done.
Yeah.
So yeah, that's the main point. Like, I personally just don't see any. Like, I don't know if there's any, because like I see people who take the same medication, and this is in the United States, that take the same medication, whether they are working or are elderly, right? And they have privately owned insurance through their employer, right? And the only difference between them and someone who is elderly is like they have a copay of like a couple of bucks. Like that is the only difference. But they get the same health care. So why should there still be a lot more money taken out of your income for insurance that's going to give you the same type of health care that they would give someone who is not working? Like the one argument that people that work and have more money, they get the best health care, right? But if I have a guy, if I know someone who, an area, if you want to come up, maybe you can elaborate on this, I don't know. But I know someone else who is a union worker who makes a lot of money working as a laborer. But they take out a bunch of money from his paycheck for his quote unquote great health care. But yet their difference is like not it's not like the greatest. Like they'll like if they want a particular pill, they can just ask for it and they'll give it to them. But like, it's not anything different than what somebody else gets who's not working, and they have a copay of like a couple of bucks. Like that's the thing that blows my mind. I don't see the like if you're a billionaire and you can get like the cutting edge, you know, treatment, then that might make a difference. But even cutting edge is not guaranteed, you know, help. What's going on?
Hey guys, Ralph, it's good to have you back. By the way, in all seriousness, we missed you. Hope you enjoyed your time off, and now never do that again.
Appreciate it.
Yeah, a lot of those points are right. I feel like I got good health care. I am a union worker. I am heavily taxed at like 33% or so, maybe more now. I don't know. Yeah, as far as like the cutting edge stuff, like most people, if it's cutting edge, is not covered or not fully covered by insurance though. So yeah, if you have a ton of money, you can do whatever doctor you want to see. You know what I mean? They'll take cash. But yeah, the better insurance you have, the more options you have. I want to go here. I want to go here. If you're getting free health insurance, they're saying you have to go here or here. You got one or two choices, you know, at least here. So yeah, I wouldn't want free health insurance. I pay a couple $100 a month out of my check, and that I'm fine with that. Just to get the level of care that we get. You know what I mean? $5 copays for medicine, $15 for hospital doctor visits, and then like if I ever have to take a helicopter or ambulance in emergency, it's like $50.
So the main thing that probably throws me off is the amount that you have to pay out of your check. Now, Mama Bear, you know someone close to you that has gotten into a little accident and had to be taken away in an ambulance. So why do they still have to pay for that if it was an accident in Canada? I thought something like that, you know, if something happens to you, you can get, you know, free everything.
Yeah, but some of it's covered, but
Okay.
a lot of it's not.
Okay. And this individual was covered through their employer, right? Their employer insurance?
Right. But I think, if I'm not mistaken, I think his is covered, but the other person is not. Because they got to do it on two separate people. You know what I mean? Like they didn't put it. They won't cover it together. They're only covering one, but not the other.
Okay. Attend to your little guy. What's going on there?
You done forgot my
Mr.
name.
Mr. A,
bro.
Mr.
1
A.
week.
Sorry,
You
buddy.
done forgot my name.
Go ahead, buddy.
Sucker. No, it's everything's income based, bro. It's the same thing like houses and cars and anything you want. Like you can go to a junkyard and buy you $100 car that runs. Ain't gonna do great. Or you can, if you can afford to buy a Rolls Royce, it's the same thing. It's the same concept. The more you can afford, the better health insurance you'll get. Like if area has, those are nice copays, and if he pays for private insurance, he's going to get better treatment than if somebody who works at McDonald's has a medical card from the government. You got to go to the clinic. It's everything is income based.
So the two things, right? Now I understand what you're saying, but there's two things that I keep seeing. That's like, because I'm trying to understand because when you hear people like Bernie Sanders blow out this talking point. Oh, we need universal health. Like I already gave you the example of Canada. Like this, I don't see any difference.
Oh,
Yeah,
You
no, we
know,
have that here too. If you don't have health insurance or if you don't have money and you go to the hospital, you can fill out financial aid. And
right,
depending on what you make is how much more or how much less you pay towards your hospital bill.
right,
We have
that's
that too.
correct.
We just don't have it as big and bold as he thinks it's going to be. Somebody has to pay for that. Nothing's going to
right.
be free.
Of course. What are you gonna say, Mama Bear?
I was corrected.
Okay.
Both of them were covered by his car insurance.
Huh?
But
Okay. Gotcha.
but they have insurance through the company that would have paid it as well.
Okay, so insurance from the vehicle, and then you have health insurance from
They get car
the
insurance, yeah.
car insurance. Okay.
Yeah.
So
Okay.
thank you. So then, but all right. So what I'm saying is that I don't see no difference from whatever they call universal health care and what we have here. The only difference is how much they charge, like the insurance companies, right? Because like Bernie said, you get into an accident and then you can choose to pay your bill later. They can charge you whatever the hell they want, and you're stuck with like a $20,000 medical bill that you're stuck with paying off for the rest of your life. You know,
No,
like
I
I don't
think
know
they
how
should.
that is in Canada though. Go ahead.
Sorry. I think they should change it to not universal health care, but universal health care cost. Like
Mm.
everything should have a set price.
Now that's something that that they should really talk about, because instead of Bernie Sanders mouthing off about we're the only country without blah 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 blah, but I'm like, yo, like you said, like the cost should be a flat rate for everybody, or at least, you know, like if you have better insurance or if you make more money, obviously you pay more into the taxes, right? Because like the United States and Canada, the more you make, the higher percentage of taxes you have to put in. So if you have to put more in, then you should get more out of your health insurance, right? Or your, like if you have like your medical procedures or whatever, like it's
Right.
only fair.
Did you check your Discord?
I will
No.
tell you when I got COVID in 2020 or whatever it was, I
Mhm.
went to a clinic and got tested, and it costed me like $12 or something ridiculously low. It was like $10.
Mhm.
But my work wanted me to go to a certain doctor, and when I went to that doctor, they did the same thing. It costed almost $700.
Mhm.
So that's what kills people in the medical field. Like when you need something done, it always depends on where you go. Everybody charges something different
Mm.
Dude, that's
for a
hilarious.
simple COVID.
That's hilarious because I laugh every time I go to the dentist because I look at the breakdown. If you look at your breakdown, you'll see what they ask of your insurance, and then you'll see what insurance pays. So, like, I had a
Yeah.
procedure done, right? Like, I had a crown or something, and the dentist said, "Oh, it's going to cost $1,400," and
Wow.
insurance said, "Nope, we're covering 900." And then the dentist said, "Well, guess what? It costs $900 now." And so they like settled. They settled for like $600 less. So they asked for exorbitant amounts, dude, like just crazy amounts of money, right? And
Mm.
if they can get it, they'll get it. Because if my insurance said, "Yeah, we'll cover that," I'm not going to charge 900 or 400. You know what I mean? They're going to get that full amount they asked for. It's just it's mainly a cash grab, dude. Like there was a hospital here in town, and it got nationwide attention because they were charging people for like toilet paper, just ridiculous things, and they were
Mm.
charging crazy amounts, bro. I'll try to find the story for you, but it's so stupid.
And see,
You
the
know what I mean?
problem
These
with
guys
that
can set their own
is,
price.
yeah, the problem with that is though, is the government, they just shell out money. So if somebody has the medical card or government assisted health care, They go to that same dentist, they get that done, and the government writes that off. Boom, they pay that $1,400. So they're kind of setting the standard to what these healthcare people can charge you.
Yeah. Yeah.
Because if you're on the medical card and you go to the hospital, they bill the government whatever they want, and whether they settle for less or settle for more, or whatever the money is, people on the medical assistance, they're not seeing any of that bill.
Yeah.
So wherever that gray balance is, the government or the healthcare people they're eating that. You know what I
Yeah.
mean? So they don't have to see that breakdown. They don't really care. But once you get into
Yeah.
private, they're still charging you the same thing they want to charge the government that they want to charge an individual.
Good point,
So
man.
that's probably what happens. They're so used to having medical cards, people that go, oh yeah, we can charge them this much and they'll pay it every time. So let's put it at that. And then when the insurance came back and said, "Nah, we're not paying that," they're like, "Oh yeah, my bad. You're not the government. Here, we'll give you this break."
Right.
Well,
Good point. Hey,
that's what
Nida.
really needs. The charges need to be on a universal playing field and not whatever they
Yeah.
feel like making it that day. Because I know when I had my wisdom teeth pulled, they were charging me for water to spray in my mouth. They charged me
No.
for water. They charged me for disposal. They charged me for gauze. They charged me for all kinds of stuff.
Wow.
They do that though. That's the thing. These dudes, they do that, man. You know what I mean? It's like, dang. It's like when you go get an oil change. Like, not the same thing, but I mean, like, it'll say $29 oil change or whatever it is now. I don't do oil changes, Ralph. Just to let you know, I have a Tesla, so we don't do oil changes. But like they'll say $29 oil change, and then when you go get the oil change, it's like $7.95 disposal environmental fee,
Yeah,
$2 for this, $1 for that, new this.
shop
It ends up
fees.
being $70 somehow. And you're like, hey, I thought I was going to pay $29. Oh, you forgot about this. Oh, you sat in the chair, Mr. A? That's a comfort fee. Yeah, well, you got the padded chair. That's a premium chair. You know what I
Yeah,
mean? Like they'll find
you know
any
how you
little
lean
thing to
back a
charge
little
you.
bit. Yeah, for
Yeah.
sure.
Oh, that's electricity. We use electricity to lean you back. Twisted, you're correct. It's greed. Just because they can, they will. Because you know what? If I could go into my job and say, guess what? You guys are paying me an extra $150 today because I busted my ass. I would do that. I guarantee I would do that. 100%. Yes, I
Right.
would. But, we can't demand, say, Ralph, I drove into work, so you got to pay for my gas. I, blah, blah, blah. I had to have 2 cups of coffee today, so you're going to pay for that too. And also this and that. That's exactly what they're doing, though. You know what I
Yeah,
mean? It's just not fair. I don't
and
like it.
it's not like you can say, "No, I don't want this," or I'll just wait." Because if you're sick, you're sick. You got to do. You got to see a doctor. Like you got to go to the doctor at the hospital.
Yep.
So it's not like I don't need these shoes or that kidney can wait.
So I you might have answered my question because I'm trying to piece it together, but like for someone who has government assistance or the elderly or whatever, and someone who's working in a union job, right? Let's say you both need to be on cholesterol medication, but so there's no real difference in care because you both use the same medication.
Right.
So
Not really, because if you get a generic brand, the fillers and other things and
True.
side effects are different. If you
okay.
get top name stuff, they have less fillers, less this, less that, and it's more of the medication you need. Whereas if you get the generic brand, they'll give you that medicine, but to make that pill, the fillers are different. The things that are also in that medication are different than the purity of, like,
Yeah.
whatever medication you
Right.
need.
It's like getting
Because
Viagra versus Blue Chew.
Correct. Like Viagra versus things.com. Correct.
Yeah. Yeah.
because it's all copywritten. You can't have the exact same formula. And for a certain amount of years, you can't even have any of that formula until it's been out for a while. So Viagra's been out for X amount of years now. So now you can use the ingredient that's in it, but you cannot use the formula.
Right.
So, like, when you go to get a prescription, they have the generic and then they have the name brand. And default, they offer you the generic, but for $2.50 more for my copay, I can get the name brand. You know what I mean? So
So you pay a little. You pay a $2 copay, but you get the real stuff. But they're probably charging twice as much for that medication.
But
here's another clip, really quick.
Insurance.
Here's another clip, really quick, from that Bernie Sanders interview when they were talking about that miracle treatment, Ozempic.
You guys had launched an investigation, even because this is kind of current, about Ozempic, right? And the cost of Ozempic in different countries. In Canada, it's $150 something.
Got it.
And in America, it's 700 and something.
Close to $1,000.
It's close to $1,000. That's crazy. Why isn't it just the same? Is it because they know they can charge us more because we have more money?
That's half of it, but only half of it. That's a great question. Thanks for asking it. All right. It's what my committee deals with every day. We've had, by the way, some success in the last few years, and the Biden people have done a good job on this. All right. What the Canadians do and what countries around the world do, what makes common sense, they purchase a lot of the drug, right? All right. So they sit down with the drug companies. They say, look, we have hundreds of thousands of people going to use your drug. We're going to sit down and we're going to negotiate a price, right?
Right. Of course, certainly after a few months, you should be able to see the averages and make a good.
Okay. So I didn't get the whole clip of that. But if that's the case, so then is that the difference? Because they have to ration out how much of that drug they get?
Bro, who knows, man? Are you asking?
Yeah, I don't know if that's rhetorical or whatever, but because for prescription medication, like those things, like if you know, let's say whatever your population is going to be taking this cholesterol medication, then you have to be able to prescribe that for life, and you can't ration that out. Like, I'm trying to get an understanding on how people are put on a waiting list, and they have to ration out treatment for people that it's under this so-called universal health care that Bernie Sanders is talking about.
Yeah, it's got to be spread across. That's why you have to go somewhere else to get certain treatment, because whatever place that they have where Mama Bear might be, they may be overwhelmed with people. So you have to go somewhere else to get the same treatment. I think
That's true.
it's a lot of the same here too. Like doctors here, if you go to a doctor, they're going to say, yeah, you know what? I think you're right. It could be, let's say, it could be your kidneys. So then that doctor sends you to a specialist. And to get into a specialist, you can either find a top-notch one who may have some open spaces, or you can call just a normal specialist, and they're going to tell you the same thing. Like, oh, well, we can set you up for 3 months from now. Kind of busy right now.
Yeah.
Have you guys ever had any problem with prescription or getting the right medications?
It's not the right medications, but they always kind of like try to sway you to take a certain one. You know what I mean?
Or
like
they'll say, do they try to save you money?
No, it's like if I go in for something, let's say, for instance, like high blood pressure, and the doctor's like, oh, I'm going to put you on, whatever. Even though there's 15 other medications available, and one might be better, one might not. He just kind of chooses one, and I'm sure there's a reason for that. You know what I mean?
Oh, I'm sure they get paid out from big pharma. Like, hey, look, if you prescribe so much of this, you'll get a kickback. Or if you prescribe so much of this, we'll donate to your hospital for other reasons. I guarantee there's definitely
Yeah.
kickbacks coming out for medicines being prescribed.
Well, as long as it's not like the ketamine that was given to
Oh man,
Matthew Perry. Oh, sorry, that's too soon. Too much.
Oh, Ralph William.
Yes.
Did you know we're the only country in the world that doesn't offer free BBLs to all women?
BBLs.
I want to make it so all women can get free BBLs.
Okay, so I'm not gonna. I've gotten someone sent me an example of a Canadian
BBL.
No, whatever they earn, their income.
Oh, sorry.
And this is how they are taxed.
Okay.
You know, or what shows up on their pay stub of what they paid. So, gross pay is
ew.
Yeah, I know it's gross.
Gross.
3,051.
Okay. That's what you should get before taxes, right? Okay.
Right. Federal tax is $699.26.
Not bad. Not bad.
Canada.
That's not much.
Yeah, Canada pension plan. That might be a different conversation.
That's their Social Security.
Is that what that is? Oh, okay.
Yeah.
Something like that, I guess.
They take out 173. They have employment insurance. That's 50. There is a co-pension. I don't know. That's like 152. I don't know what that is. What is this? RRSP. I don't know what that is. It's 20.
Yeah, the co one I think is for spouse, and the RRSP is for when you're.
Oh, for when you retire. Okay. Medical benefits. They take out 58. Dental. They take out 17. Life insurance. They take out $14. Obviously, I'm rounding it off, right? Dependent life.
Man, I gotta pay for my life insurance, my wife's life insurance. I gotta pay for her pension and my pension. She gotta get her own damn job.
$3. Long-term disability.
Yeah,
that's $1.60. Okay,
and $1.
Yeah, so their net pay is what they take home, I guess, is $1,797.
So, and the starting number was the gross was how much?
3,051. So that's about half of their money gone.
They took them. No, it's about 35%. It's a little high, but it's not much higher than ours. But that is a little high. She started at 3,000. They took 1,000. Well, about 1,100. They started at 3,100. That's about 33%, 35%.
I don't know, but how bad did you feel? Like you've made $3,051.
Yeah.
And you get home 1,790. Now I don't know, if this is bi-weekly or weekly or whatever, but this is just an example. But that's how they break it down.
Bi-weekly.
What they pay. Is it bi-weekly? Okay.
Yes.
So that's what you're paying into in Canada.
I don't think I would agree with the paying for the spouse, all that stuff. I don't sound fair, but
right. So
it's crazy, dude, because I make just shy of $50 an hour now. Okay. After taxes, though, they take a third of that, and so I'm seriously considering becoming a Denny's server so I can get those tips. Hopefully, tax-free tips, baby. You know what I mean? That's what I'm looking forward to. I might make about the same amount.
Yeah, which is something that Kamala Harris has advocated, but the first person who have said it was,
They knew that was a huge selling point, dude.
Yeah, of course. Of course they were going to get a lot of votes on that, or people liking it.
As you know, he endorsed me full-throated.
But that's usually what, that's what you have to do in politics.
Full-throated.
When you're endorsing people. Full-throated. You have to endorse
Yeah,
it.
baby. Yeah.
Is that what Kamala did?
Great
You know
endorsement.
what I'm saying?
Yeah.
Great
it was a
endorsement.
Great
Yes.
endorsement. Full-throated. So that those are the only differences that I see, man. Technically everybody gets health insurance here. So I don't know what they are, what are they really pushing for? Like, it talks a good game, but I don't see what comes from it. Obviously, like we said, your taxes or increase in taxes is what's going to go into this quote unquote universal health care, right? But there's no difference than what's happening now. It's just called something different.
Yeah, in all honesty, the healthcare only really helps people under and over the median income. Because if you're at median income and your company supplies insurance that you have to pay for, I mean, typically you're at least $100 to $200 a week for insurance. So if you're making $15-$20 an hour and you barely break the median income, that extra $600 to $800 a month is gonna hurt to lose, and you can't afford. You can't really afford it. But then you make just enough money where you can't get free health care. Those are the people that are dying from health insurance.
Yeah, because it sounds like the only people that are really getting hurt by this is the middle class, which is the point that I'm trying to make.
Yes,
Right?
And that's in every situation, though. That's in everything you pay for.
Right. Because those that make more than a certain bracket, they're not hurting, right? Like they can afford to put out an extra 30. I don't know what the actual tax is on a certain tax, bracket is, but for those that have to pay 40% of their check for all this public service, I don't know, social services or whatever. So that means like someone that takes home that's used to living off of a paycheck of $2,000 would have to take home like about $1,000 in change and have to pay $2,000 prices on things. Like it just doesn't seem logical to me. Like I don't understand how, and they're going to get taxed again because in Canada they have a goods and service tax, right? Like kind of like what we do, I think. So like if you want to pay high prices on that cheeseburger or whatever, it's going to cost you. I don't know.
Goods and services tax be like our sales tax? Is that what you're saying?
I think that's what that is, because that's what they call it in Canada. Goods, GS, whatever. Goods and service tax, which is like your sales tax.
Your GST check.
Yeah. GST.
Yeah, GST. Sure. You can get a GST if you, whatever, you can get GST checks. I think it's every
So if you haven't learned anything out of this, you have to be like somebody I might know that makes well over 50 an hour and drives a Tesla to make it in this world and continue to thrive in California.
Right. And that's,
thrive? I don't know about that.
And that's if they moved to Indianapolis, I think, or Illinois.
Oh, that was the map time. You die.
I think Indianapolis or Illinois. I think that's like the least. What is it? Damn, what is the word?
Tax cost of living?
No, the least cost of living. The least cost of living.
I thought it was like Arkansas, bro. I
probably
maybe that's just cheap.
You'd have to pay me to move to Indianapolis.
I don't want to go to any of those places.
If you're making what you're making now, area, and you're living in Kansas, Arkansas or whatever, like, bro, you can have a mansion. You can have
King of the Hillbillies, bro.
Yeah.
King of the Hillbillies.
King of the Hillbillies.
I'll be the
No,
king.
we need more places like Pennsylvania that don't have sales tax on a lot of stuff.
Man.
And in
man.
and in Texas too, probably, right? Which is
Texas,
probably why a lot of people from Cali are moving to Texas or have moved to Texas, no?
They are definitely California-ing their Texas, bro. Like,
yeah, that's what that governor said, right? Don't come over here in California or Texas.
Yes, and they're doing that, and they're saying, and they're driving the cost because they're selling their house here for $800,000, and then going over there and buying a huge ass lot, for $400,000 or $300,000, and driving the price of all the other houses up, the value. You know what I mean? And yeah, dude, it's just they're California-ing their Texas, taking all their Teslas over there and macchiatos. You know what I mean?
Damn Teslas.
Yeah.
So the takeaway is, I think, the working class is going to pay more for everybody else. That's the takeaway. That's the only difference.
There's more working class people than there are rich people. And
that's a good point.
Yeah.
Yeah, that's a good point.
There goes a Cybertruck.
Would you say there's a Cybertruck?
Yeah.
All right. Well, thank you, everybody, for this understanding of universal health care and
wonderful
United States healthcare. What is really the difference? You're going to pay more. That's the only difference. You're going to pay more. Thanks, Bernie.
You're welcome, Ralph. Absolutely.
As you know, he endorsed me full-throated. Great endorsement.
I definitely endorse Donald James Trump, or whatever his name is. Full-throated, Ralph. All the way down to the boss. All the way down to the boss.
Let's take a quick commercial break. I wish I had a commercial. Man.
As you know, he endorsed me.
I wish I had a commercial. Oh, shoot.
Hey, Ralph, I heard you. I don't want to get too much into this or rehash the whole thing, buddy, but I heard your gripes, overheard the gripes there about paying taxes and all that, and the hands in the pockets and all that, and I get it, yeah. What I say is cry me a bloody river, my friend. If I look back at my 25-year career upon the taxes, which I have paid unwillingly, I'm still here. Man. I still think there's a bright future. I mean, you don't hear me complaining all the time. It's not doom and gloom. I'm just saying, I could have put motherfuckers through college with the amount of money they took from me, bro. I'm just saying.
I believe it.
I'm just saying. Enough said. Carry on.
I was just wondering, I don't know if you know offhand, because we were talking, and I'll try to make this quick. We were talking earlier about the Bernie Sanders interview that he did and advocating for universal health here in the United States, and trying to figure out like what real differences there is between here and any other country. And I just wanted to know, like, not with your specifics, but like, how much do they take out for certain income for health insurance? Like, I guess it depends on which company you have, right? But
when you get employer-based health insurance, well, the more, okay, so when it comes to employee-based health insurance, you usually will have a choice between different options that they have available, depending on the size of company. There could be a big company, could be a small company. Some may have one healthcare plan that you can choose from. This is the benefits we give you. Others will have, here's basically the options that we have, provide what suits best for you and your family needs. Okay, and then so other things that come into how much the coverage is going to cost is what do you want? Do you want dental? Do you want vision? Just health? Do you want this short-term disability, long-term disability? What do you want? You need health because you got elders you got to take care of, kids. We got things we can sign you up for that. And then it becomes all right. a lot of these costs that you pay into are pre-taxed, so they take it before your money gets taxed, so it doesn't get taxed twice in a way.
Mm-hmm.
You know what I mean? And so obviously, more money that you make, it's all your elections on your health care for the year that you choose, right? You pay based on what your elections are.
Mm-hmm.
Okay, you want the priciest healthcare options, with all the bells and whistles. Okay, you're gonna pay, and depending on how many dependents that care is providing for in your household, you got one child, no kids, you got 5 kids, you got 12.
Right.
Are you married? Are you single? Or do you have a domestic partner? Or is it same sex marriage? Like all of these things, the health insurance companies have different calculations, and they bloop, 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 bloop. Here's what you owe us. Here's what we pay. And then that's what you pay in every check. They take a little bit out of your check, and that's it. And then you got to meet their demands. Spend this much money, go to this doctor, use this prescription plan. So yeah.
So,
and when it comes to just want to mention, when it comes to comparisons with other countries, we just got to remember first, a little simple math. We got close to 350 motherfuckers in here, right? 350 million people. Okay, beep beep beep. Sorry for my.
That's fine.
It's Monday. It's Satanic Manic Monday. We're gonna roll with that. 350 million compared to other countries. Even you can throw in there, the UK. You can throw in Canada. Even both of them combined, they can't get anywhere near us.
Right.
Like we have some states that blow them out. So that being said, right, we are not a very healthy country. We don't eat very healthy, and that's full stop across every damn state from shining sea to shining sea. I don't care where you live. You got some fat people everywhere, bro. You got people drinking the 64-ounce sodas all day long, every day long. That's fine. That's cool. You do that, but there's consequences with that, right? So there's high rates of obesity, high rates of heart problems. We got smoking. People smoke cigarettes, right? A lot of that stuff. We got issues, right? So anyway, it gets expensive, right? Providing for all that. We have all these cancer, treatments and all, because our water's screwed, our air is screwed, our food is screwed. You know what I mean? Okay.
Right.
So it's expensive. So how much is that going to cost per person, right? To just kind of have all healthcare needs taken care of. You need glasses? Here you go. You need some pills? Here you go. You need, boom, you need to see a doctor? Here you go. You need X-ray, MRI? No problem. You need a tooth pulled? Okay, we got you covered. Cancer? That's fine. You'll live. No issues. But how much would that cost for every person? Because you can't put that on and then say, yeah, you get it, but then you can't have it. No, because when you turn it on full stop, everybody. And don't give me this, oh no, you're illegal, legal immigrant, migrant, asylum, insane, asylum, crazy in the membrane. It don't matter. Like a human is human.
Right.
It becomes humanitarian. So I think, that's just my fair use take.
Good job. But that's the only thing that I'm having trouble with is so since there's 2 different tax brackets, right? So when they if they was to implement this universal healthcare thing here in the United States, what Bernie's wants, is it going to be like a whole big money pot from different, percentages from different tax brackets put in to one big honey pot, and then it just gets divvied up to everybody? So the ones that are putting in more because of their tax bracket, are they getting the same health insurance or health care than someone who maybe not pay as much?
So
how do they divvy up that type of health care?
So it would depend on how they craft the legislation, right? But in my eyes, in my view, it doesn't matter if you're a homeless person or poor, and it doesn't matter if you're rich or wealthy, and it doesn't matter who you vote for, or if you've ever been in jail or associate with a known person that's been in jail. I don't care. You're still a person, and you would still require health. health benefits. So there should be, if it's enabled, then there should be a universal set of like rights, healthcare rights. You need glasses, you get glasses. You need your tooth pulled, you get your tooth pulled, right? For everybody. Why do we want to continue to create separations and divisions and say you can have it but you can't? And you over there don't even think about it because you're not even gonna be, we're not even gonna think about you. Don't even.
Right.
But why? Like at the end of the day, it's like another person. Like, that's just me. Again, it comes down to how much it can cost. The only way how you gonna take care of that, right? You either bring in more money or you cut how much you're spending. I mean, yeah, it sounds that simple at a high level, but how you gonna make money? Taxing? Who are you gonna tax? Either people, corporations, wealthy. I mean, that's what the taxation is there for, no? To generate some kind of wealth or at least revenue there for the governments.
Right.
Otherwise, reduce some spending. I mean, how many bombs and tanks and planes? I mean, for how long do we need that stuff? I mean, I don't know. I mean, look at our spending, right? Like. Also, current programs like Social Security, Medicare, Medicaid are expensive. They're going to also continue financial needs to even be further supported going forward. Like I've been paying damn near 25 years into Social Security. I mean, I may not see a lick of it when I retire. There might not be enough money in there for me. There's too many damn baby boomers. It's just math, statistically speaking. It's a known issue right now. It's running out of money. But we're too worried about, oh, you did this. Oh, we're going to impeach you and impeach him. And look at your family. Oh, and look at your family. No, there's too much bickering instead of worrying about like the big people issues here that affect every single person, man. But I don't know. I think it would be expensive. I don't think it'd be easy. I think there would be a lot of backlash for it. But I do think it's basic. It's like a human basic right for a person like to get care. Like why deny a person that? Like this, like the same things. Like why, like financial debt, getting into financial debt because you're trying to just live, be healthy, like fight whatever cancer because you live in whatever town and whatever big business spilled damn oil in the river. You know what I mean? Or the damn tar pits burnt a little too close to your white picket fence. You know what I mean? And it's like, well, shit, fuck a dentist. I'll just deal with the pain. It's too expensive. Like, why? Like, why? That's not like basic common decency toward like humans. It's not very humanitarian. You know what I'm saying? Like,
yeah, gotcha.
But damn well they turn it on is going to be like, well, I paid this much money and I can get this. You can't have it. Where are you coming from? Huh? Where? Let me see your papers. We can't do that, bro.
I don't want to share my insurance, though, with poor people, Ralph. Just let that be for the record. They can have insurance.
He endorsed me full-throated.
Just not.
Great endorsement.
Good take, Farias. All right, gotcha.
Thank you, sir. Thank you.